So MedTrack is an application that was built to help patients track their medical information. MedTrack, by and large, is a patient-centered application that helps patients put together all their medical history on one platform and have access to this information at their own convenience and at any point in time they need to. So the patient has access to their prescriptions. You can always view all the prescriptions that has been given out to you, the dates and the dosaging of those prescriptions. So that patients no longer have to count on their powers of recollection to be able to tell what medication they were on, when they were on it, and how long they took the medication for. They also have access to their clinical visits. So if you open on to that, you can have the various visit times with the time stamps on it, and patient can then always refer this information to other physicians for ongoing care. There's also the diagnostics that would have come in from either radiology centers or laboratory centers with their basic labs that they've done over the period. Then health data. Patients' blood groups, allergies, known pre-existing conditions, and the current medication they are on are all captured onto the system. Their body mass index is also calculated based on their weight and height. That gives us an idea of whether they are underweight, whether they have normal weight, or whether overweight, or in some cases even obese patients. And then their emergency medical contact. This is a person that in times of emergency we would contact when we can't have access to patient's information, be it that the patient is unconscious or access to the patient to grant us information is difficult or impossible under those circumstances. So the emergency contact person is also available. And then the last with the person's contact number. Now the last hospital visited is noted, and the primary doctor, if the patient has a primary doctor, is also available on the site with the primary doctor's contact information. All this is built onto the system to help us or to help patients have access to their information even when they are not able to grant this access directly. So in times of emergencies, you can still access the application, have this information, contact the emergency contact persons and then the doctors and then have some basic information that can assist in emergency care for this patient at any point.